So, Namaskar once again to one and all, and welcome to this session called Inspiration to Publication. May I have the pleasure to introduce the speaker, Dr. Pooja Sharma. To us, she is a member of our Research Advisory Council member at CAHIR. She is also the CEO of Apar Health, and she's a gynecologist by background, a clinical research leader, and the most important, a patient advocate for research. Academically, she accomplished her MBBS and MD from the prestigious Institute of Medical Sciences, Banaras Hindu University, and MD in Obs and Gynec. She is a trained gynecologist for over 30 years of experience in clinical research, predominantly at AIIMS, New Delhi. Society for Applied Studies, Medanta, the Medicity at Gurugram. She's the ex-director research of the Medanta Gurugram. Personal clinical trial work in vaccines, especially related to rotavirus, COVID, chikungunya, and dengue, has been a part of her accomplishments. She's the founder and CEO, as I mentioned, of Apar Health, with a keen interest in two areas, the SPARK and the PACER. The SPARK is demystifying clinical research for youth, and patient advocacy for research is the PACER. Ladies and gentlemen, all my students, my dear faculty members, it's a pleasure to introduce Dr. Pooja Sharma to you for the session, Inspiration to Publication. Over to you, Dr. Pooja.
Thank you, Dr. Sucheta, for such a lovely introduction. So I'll go directly to my slides. Please do let me know if they are visible. Are we able to see the slides?
Yes, the slide is visible and you are audible. Before you start, I wanted to give an instruction which I'll post in the chat. If you have any questions, please post it in the chat. Because the number of registration was 246, we converted ourselves from Zoom to Zoom webinar to accommodate. I am also told that the people, some faculty members are joining from across out of India also. So if you have any questions, you're not able to connect, then please post it in the chat box. We'll take the question at the end of the session from the chat. Thank you so much, and over to you, Dr. Pooja.
Great. Thank you all so much. And I'm so excited and highly stressed to hear that there are so many people listening to me. So please be kind and generous and believe that this is going to be a nice talk. So today we're going to talk about your first paper. So this is actually targeted to young researchers, young wannabe researchers, and definitely to mentors who are mentoring those young researchers. The concept is from idea to impact. So as Dr. Sucheta mentioned, my very clear passion, one is to, inspire young researchers like yourself. But second is to ensure that we do not forget why we are in healthcare space and why we are doing research. So this is our little project called PACER, which is Patient Advocates for Research. This is a young girl who has always, her picture has inspired me, brought tears to my eyes. Of course, you can make out she's a patient of cancer and she's under chemotherapy, but you see the happiness and the excitement when she meets the doctor. So it's very important that we remember that this is the purpose why we are doing research. I want to share with you a small story. I request you to listen to it patiently. The audio is not very clear, but please do listen to the message.
I welcomed my second son, Ashok, soon after my mother passed away. Ashok was born a very healthy 3.8 kg, happy, playful, stubborn, smart, and very, very cute. During COVID 2020, he started looking a little pale, and then he would complain of leg pain, ear, hand pain, thigh pain, etc. So we took him to the pediatrician, which was very hard to do because everything was shut down. And the pediatrician thought it was toxic synovitis, and Google also agreed. So I relaxed. But then it persisted. So I went back again and we decided to do a scan for juvenile arthritis. That is when we saw the tumor on the adrenal gland. So when we did the PET scan and I confirmed it was actually cancer, it was extensively spread to all his bones and his lymph nodes, I was terrified. So I do what I always do, dive into research. I found some online papers from Indian authors on neuroblastoma, and I wrote to the first doctor. I decided to find clinical research which will take me out of this treatment into something else. And I found the US clinical trials. and I found MSK, and I found they have something called naxitamab. And then I came across clinical trials on DFMO. So this me, Dr. Sunil Bhatt has also encouraged other patients to try DFMO. And now I think the trial is also coming to India. But yes, it is not enough that our doctors are so capable and so well educated. I think we should update our documentation that we publish to know what is the most optimal treatment for anything and how to go about getting it. And yes, we must have clinical trials in India.
So the message that I want you to hear from what she says, she gave out several messages, but the most important is the purpose of research. There are patients like her and patients like her son who are looking for Indian research. So while there is research and there is development happening globally, it's important that we do our research and we publish our research, and so that the patients are able to access that. Next part is, of course, how do we do the research, which is the methods. And here I'm going to use my acronym SPARK, wherein S is spot the problem, P is plan the question, A is acquire the evidence, R is then run the study, and then K is move your knowledge to a publication space. But the toughest question that happens when you're doing your first research is actually, where does the idea come from? What should I do research on? Right? That probably is the toughest question. And the answers to this really come from curious reading. And I will share with you some examples how simply curious reading can result in such exciting projects. Keep your eyes open during rounds. Problems that are faced by patients daily in rounds are the problems that you need to solve. The daily frustrations of a clinician, the daily frustration of the nurse, the daily frustration of the patient, that is the space where you need to work, and that is where your ideas will come from. Now, this is a very interesting newspaper article that so I have a young team that works on interesting projects. And so this particular paper was talking about happy fish. So this is salmon being exposed to anti-anxiety medications in the Norwegian countries, and it makes them risk takers. So salmon anyway go upstream, but these salmon actually were going by not in groups, they were moving not in schools, not in shoals, but by themselves. They were actually going and hitting dams, they were jumping off cliffs, and ready to die, and they were very happy. And why was this happening? Because antidepressants from the systems in the Norwegian were entering the ecosystem of the water. Now, this inspired our team to think, what is the problem that is happening in India? So this is a one world health situation where something in the human health space is impacting health of other organisms, including other organisms then impacting us. So let's think about it. And my team said, okay, let's think about what is happening in India, because definitely antidepressants aren't our problem. So what is our big problem is antimicrobial resistance. So here is a paper that came from this conversation. This was a general newspaper article that some student read. And from here, the conversation went to One World Health, what problems affect Indians, and antimicrobial resistance. And a young student called Saisha, who was in her 11th grade at that time, came up with this concept paper and wrote about how we know and how we act. Her question was that, what do we do with antibiotics at home? So in the hospital system, we all know what happens to antibiotics. But do we know when antibiotics are bought at home? And so I'll buy a 10-day course, and then I finish a 6-day course or a 7-day course and I'm fine. What happens to those remaining 3-day course? Is it given to the maid? Is it thrown in the water? Is it thrown in the dustbin? Where does this go? So this very interesting knowledge, attitude, and practice study that was done, and she compared an urban and a rural setting. And interesting for you to note that it made no difference if you were in the city or you were in the village of Faridabad, you pretty much did the same thing. You threw it in the dustbin, right? So it's very important for us to know that the questions can come from simple observations. Now, this is a child who observed the hijras on the road. I mean, all of us do, right? And they're begging, and sometimes we give them money, sometimes we don't. But this particular child observed that and thought about it and actually wanted to read about how gender is being explored and how India is now moving, right? He worked with a plastic surgeon who works in gender reassignment surgeries and wrote a very interesting review article. And this is a child who was in grade 12. So, what I'm saying to you is that ideas come and ideas go. We do not observe them and act on them. That's the only thing that we don't do. Now, this is another child that was very interested in his mother used to think, this is a kid who's all the time interested in music, doesn't really focus on his, studies because all the time he's wearing his earphones and listening to music even when he's doing his studies. He believed that he was listening to, and he used to listen to really those, the really loud and electronic kind of music. His mother was very worried, and she's a friend of mine. He actually then did a study. He went down and visited people in the National Brain Research Center, and he found out that how music inspires children and how music can act as an aid or a distractor, right? And he did a very nice survey on this, and he did a review article and actually had a nice publication coming out in this space. Now, this is one of the very interesting ones that I really liked, how the inspiration came. On the right side is a newspaper article where there's a drawing saying our children are growing up thinking smoke in the sky is normal. This is for Delhi, of course, not so much for Belgaum, because Belgaum skies are blue. In Delhi, skies are gray. So here there were drawings by children showing that in Delhi, children are starting to think gray is the normal. Right, this newspaper advertisement and about awareness of pollution actually inspired some of our children. Now, we usually do a national, day of clinical research in May, and we ask children to make posters. And I'm sure there are many poster competitions that happen in your college also. And what do we do with those posters? We usually give a first prize, second prize, third prize, and that's it. But my young team said, what can we do with these posters? That, we had a submission of almost 100 posters. Can we do some kind of an analysis on the posters? So this was done, of course, these was posters made by young children with cancer. So we actually evaluated, the young team evaluated the posters that were submitted on what is the understanding of a patient, that the situation given was, please explain how do you feel about research? What do you understand about research? And children had different kind of drawings. The researchers used a tool called the DrawApp tool. So when you look, वो हिंदी में कहते हैं जिन खोजा तिन पाइया, when you find you shall, when you look you shall find. So they found this very interesting tool that actually gives an analysis of the picture. So it had a thematic analysis. Conclusion was that children understand concepts better by drawing. We actually extrapolated this to say that assent of children, when it is taken, especially in children who are less than 7 or 8 years old, should definitely, or 7 or 8 years old, or more than 7 or 8 years old, should be taken by some kind of a drawing or some kind of a infographic versus a textual writing, right? That was the extrapolation that had come from this particular paper. Now I'm going to take you to a little flashback. Now, when I was doing my MD, and that's like several years back, almost 30 years is what Dr. Sucheta has just mentioned. I was starting my MD in my gynae ops. Now, the time came when, I have to think about the thesis. I said, okay, the first thought that came to my mind, I was a very, not a very hardworking student. I was a hardworking resident, but not a hardworking academic. So I said, okay, let's pick up and do something on episiotomy, because episiotomies we do so many. I will get enough sample size very easily. Let's do episiotomy. Whether, it should be done in 1 layer or 2 layer or 3 layer, because different people had different residents had different kinds of impression. Some said, you must take a layer of the muscle. Some said you must take only the mucosa and the skin. So there were different But my guide said this is an irrelevant question. Who is bothered about how many layers you do episiotomy and what is the relevance of it? Okay, I let it go. The second thing that I used to see, and this was in Banaras, so there were a lot of patients used to come with severe anemia, and we used to have severe postpartum hemorrhage sometimes with, children, and then we would lose those mothers. So I thought severe postpartum hemorrhage is something interesting, and shall we work in this space? My guide said no. She said no. You are going to work in cervical cancer because that is the most interesting topic. And let me tell you, I think everybody in that area, in that year, pretty much everybody who was doing gynae obs at that time was doing cervical cancer, right? HPV and cervical cancer is what I did. I was pretty much at the run of the mill kind of a thesis, and I managed to have some kind of a, I think, poster, not even a paper out of it. But let me tell you what some other people did, okay? So the question that I had asked, whether episiotomy should be done in a single layer, three-layered technique or a single knot technique, actually resulted in a double-blind randomized control trial. And this was published in 2016. Comparison between 2 and 3 layers. If I had published it in 1990 something, where I was doing my thesis, I would have been ahead of this person. I would have really done a cost-effective analysis and I would have really published an interesting paper much ahead of the time. Postpartum hemorrhage, right? We've always, at that time, we were using Foley's balloons to actually create a tourniquet, like a pressure situation. In case of, placenta accreta, percreta, increta, any of those situations where there was, we would use the Foley's. And I hear that today also many Indian systems are using Foley's to prevent postpartum, bleeding, postpartum hemorrhage. Had I done this study and developed a new technique or a new technology, which was later developed by Dr. Bakri, and Dr. Bakri's Bakri balloon, which is pretty much a very small modification on the Foley's catheter, is one of the most important innovations identified by BMJ Innovation. This particular product is currently in every postpartum kit that is given by the WHO globally to prevent postpartum hemorrhage. Now, if my ideas were not ignored by my mentors, I might have actually resulted in something interesting. So I really implore the mentors listening today that please let the students, this idea of a thesis and a first research is truly just to inspire the student. Please let the student work in the area that inspires them. And then you rest assured that they will take research to a different level beyond what you have even imagined. So now coming to the more nitty-gritty of things, of why we do research. Now, research is primarily done to find the truth, right? Now, what is the truth? Truth is a very difficult thing to find. Truth needs to be generalizable within the group being tested. That means within the team that where you are doing your study, right? So like we are doing a KAP, a knowledge attitude practice, simple survey, but it depends that the survey will only inform me about the group that I'm studying. If I study this group on, young interns, the information that will come is of that intern batch. It is not something that can be extrapolated to gynecologists, but it is within all interns, it will probably make sense. The second part of the truth is that this should be relevant beyond the group. So, of course, it will be relevant to interns at KLE, but will it also be relevant to interns at BHU? That is the extrapolatable truth. Now, research must ensure that it is truth that is generalizable within the group, that is internal validity, and extrapolatable, that is external validity. That's the purpose of research. Now, let's look at this levels of evidence, pyramid that we've all been studying. And I'm sure even if you are a first or second year or third year MBBS student, this levels of evidence has been taught to you. This is probably part of Hutchison. This is, of course, part of Harrison and PSM and all other books. Now, levels of evidence we believe traditionally is that expert opinions are at the bottom, then come the case series and reports, then the case control studies, then the cohort studies, then randomized control trials, and then the systematic reviews and meta-analysis. Interestingly, there was a very nice BMJ paper talking about the change in this pyramid. So while you will see that in the previous more extreme pyramid, at the top is randomized control trials. And that's why many researchers, and like myself also, used to, in my 20 plus years back, think that unless and until I do a randomized control trial, I will not be able to get any good research results. But interestingly, the world is changing. As always, things change. Today, this pyramid is no longer such an extreme pyramid. There are cohort studies which are doing better than randomized control trials. So observational studies which will do better than randomized control trials. And secondly, even the regulator today, including the US FDA and hopefully soon the Indian regulator, is accepting a lot of cohort or real world evidence studies even for regulatory purposes. So there is a change happening. The importance of real world evidence is becoming even more unchallenged. And so those who are looking at their first research paper, I will request you, do not try to do a randomized control trial. Try to do a good real world evidence, good cohort, good outcome study. That makes you feel confident, creates enthusiasm, and then maybe you can go to a randomized control trial in a later time. So types of research are the observational and the interventional. Observational are where the researcher does not do any manipulation in anything. They just observe things in their natural settings. These are also called real world evidence studies. These could be cross-sectional, that means like a photograph. Right now, what's happening? It's a one-time evaluation, which is called a cross-sectional study, or something like a cohort. That means you pick up a group and you follow them over some time, which is like a video. So that's a cohort study. The other is the case control study, which is a look back risk factor associations kind of a study. Frankly, I have never done a case control study. So the real relevant studies become cross-sectional and cohort. And these are both very interesting tools. And if you can actually control and command and understand these two, you have covered most of the research that's happening globally. Then, of course, there's the interventional studies, which are where the investigations or the research investigations, researchers deliberately intervene, right, in the study participant's life to observe the effects of those interventions, such as a treatment A or a treatment B, where, randomization when they are randomly assigned. Now, again, this is to emphasize that, real randomized control trials can bring a particular kind of information. But real world evidence studies, which are like cohort and case control, actually bring out more relevant to the world, to the real life situation data. And again, I will emphasize to first time researchers to please do cohorts and case control studies as your first effort. Now, here is randomized control trials of non-sugar sweeteners. And this is a WHO white paper. Again, if you read, you will be inspired. So look at what what's the world looking at. There's some interesting WHO white papers. One is on exercise. One is on mental health. There's an interesting one, of course, on this non-sugar sweeteners. Now, non-sugar sweeteners in randomized controlled trials showed that body weight will be decreased, BMI is decreased, type 2 diabetes may or may not increase. There is no increase in all-cause mortality. But interestingly, cohort studies, which is real world evidence, shows there is increase in obesity, increase BMI, type 2 diabetes worsens, even mortality increases. Now, why is this happening? Because in randomized controlled trials, these people are given the non-sugar sweeteners, which is, the diet Cokes and the diet Rasgullas in a very limited fashion. Right? So they're given only for your cup of tea, or they're given 3 doses a day. But in real world, what people are doing is people are making cake out of it, people are making rasgullas out of it, people are making gulab jamuns out of it. So therefore, there is increased obesity and BMI. And what really makes a difference to the human being is not what happens in a randomized trial. It's what happens in his real life. So this probably might be an interesting study for a youngster like you to do. Now, when you've thought of your area, which is the background, this whole background was around what area should you work in? After you've thought of which area you should work in, for sure you should look at what your research question is. Now, the research, if you define your research question, and I have been sitting on several, students' presentations, and I'm sure Dr. Punya, Dr. Sucheta, and all the other senior members here also sitting on several thesis presentations of students who will say a lot of things but not focus on the research question. Research question is the one that defines what's your kind of study that you're going to do, your sample size, what is the parameter you're going to study, what's the outcome indicator, and even the ethics is answered by the research question. So unless and until you are able to formulate a clear research question, do not proceed to the next step. Now let's look at, robot versus robot. So in India, there's a very interesting new, company that's making the Indian robotic, which is the SSI Mantra, and the old original robot, which has been forever there, which is the Da Vinci robot. This is the robot that's used for several surgeries. Okay, so I'm not going to I'm just saying we're going to compare the Indian robot versus the original robot, and let's see how can we do this. What's the questions? What can be our questions? Our questions can be, is Indian robot, what is the safety of Indian robot versus safety of the old robot? What is the efficacy of our Indian robot versus the old robot? What is the effectiveness? Effectiveness and efficacy are two different words. I will request all of you to please go back and read these. This is a question to be read. Of robot A versus robot B. Do we want to say our new Indian robot is better than the old robot? Or do we want to say it's as good as the old robot? Or are we saying it's not worse than the old robot? If you are saying any of these terms, there is a difference in the study that you're creating. The better, A is better than B, means you're doing a superiority study. As good as means you're doing an equivalent study. Not worse than is a non-inferiority study. And the whole implication of all three is different, right? So it's important for you to see when you're looking at the question, please define it carefully. Now, when you're doing this, can you also please look at what are the confounders? Confounders means what are the other factors that can affect your results? Like what can be the factors? Of course, the surgeons, the surgeon who's handling the old robot versus the new robot, there may be difference in experience of the two surgeons. If there's a younger person handling, he may have lack of experience. Then, of course, the patient parameters. If the patient is very fat, the surgery is very complicated, the patient is himself very sick, has cardiac complications, then there can be other complications happen, right? So for us to do something like what, because we've been saying, reading everywhere, the gold standard of clinical research is randomized controlled trials. Can we plan a randomized controlled trial here? It's going to be a very, very interesting one. And how can we think about it? This is a very nice acronym. When you are stuck in this question, can I do this study? Please look at something called the finer criteria. This is something which should become instinctive after some time. Is it feasible? Is it possible for us to compare the two robots by the same surgeons? Not possible, because no hospital will have both the robots. If the hospital like AIIMS New Delhi even has both the robots, one surgeon will not operate one patient on the same robots, right? So there are too many confounders and variables to make this study a randomized controlled trial. Is it interesting topic? Of course, it's a very interesting topic. Is it a new novel idea? Yes, it's a novel idea. You're looking at robots which are going to change the world. Is it ethical? Yes, it is ethical to probably do a head-on, calculation of whether this is better than that. Is it relevant? Yes, it's relevant. So the question comes to feasibility. Is it possible to do it? Now, suppose we plan to do this in a slightly different manner as an observation study, so that, it doesn't need to have a really high-end gynecological surgeon or a high-end urological surgeon to do it, but even a junior resident can plan to do this study. Can we minimize confounders? Can we make sure that we are looking only at a particular kind of patient so that the patient is not too fat, not too thin, not too sick? Yes, we can. Can we focus this on a specific surgeon? Yes, we can. Can we standardize the surgical training? Yes, we can. Can we standardize expertise? Yes, we can. Of course, we can't still put the same surgeon in on both the robots. That might be difficult, but at least we will be able to standardize so many other parameters. Have a clear PCOT, which is the other term I would like to introduce here, which is the population, intervention, comparison, outcomes, and time defined. And I'm sure you'll have an interesting publication. The second way of going about it is that you compare the robot with another surgery. So the robotic surgery can be compared with a laparoscopic surgery. Nowadays, nobody's comparing robotic with open surgeries because at least laparoscopic is being done by everyone. So you can look at what kind of research. So while you looked at your topic, you thought of an interesting idea. Now you looked at the finer criteria, defined your research question, ensured that it was feasible, interesting, novel, ethical, and relevant. Then went on to look at your PCOT, ensured that your group that you took was good. You could either plan an observational study or you could look that observational cohort study comparing A robot versus B robot, or you could look at a robot versus any other kind of surgery, laparoscopic here. Now, once you've done your study, and I'm not going to get into the nitty-gritty of how to do the study because that's another long conversation. Let's look at how to go about RRR. Who are RRR fans here? Please, I'm hoping there are a few because this is a movie I love. Okay, but let me tell you, we're not going into the movie, sadly. We're going to talk about a very lovely mentor that I had the opportunity of working with, Dr. Roger Glass. And he sent this to me in a personal communication when I was writing my first papers. I would like to call it the Rogers rules of writing. He said, Pooja, when you start your paper, start with what is your conclusion? Who does it interest? Once you have these two topics, so usually, you know how we start a paper? We will start a paper with background, we'll start with methods, we'll do that very boring way. But Roger said, first draw your conclusion, think about who it interests. Then you will actually pick up the paper where you want to go and then start writing the paper, right? So which publication you want to go to? So first step is what's the conclusion? Who does it interest? Which journal we want to go to? Look at the other publications in that journal. Look at some 1 or 2 editions before and after to see what is the kind of work that they are writing on. The other things he said is short is beautiful. Do not think you have to write a 6,000 word article. If you can make it compact, if you can make it simple, that's what people want to read, right? They want to know what your message is. They don't want to know how complicated you are. Avoid idle speculations and conjectures. Many researchers have, and when you start reading more papers, and I'm telling you, reading is a very important part of writing. When you start reading more papers, you realize that many surgeons or even physicians and publications make speculations. They expand and extrapolate. Avoid that. Conclusion and therefore your title is critical. Think about your conclusion and your title the most. The rest is what you've already done. Say what will interest the reader. So for example, he was working in the space of rotavirus. So he said rotavirus in CSF, cause or contaminant, right? Or he could write a case study of detection of rotaviral DNA in the CSF of encephalitis patients. Now, which do you think is the more exciting name? Where would you stop to read, right? Of course, you would like to read the first heading, rotavirus in CSF, cause or contaminant. It's the same paper, right? But the name is very critical. The title is very critical. He also said, Pooja, you must avoid jargons. Remember always your target audience. And grammar, punctuation, sentence formation, please remember your English teachers and credit them with the fact that they have taught you. Ensure that your grammar, punctuation, sentence is good. And now you have a lot of softwares, including AI, to help improve your language. right? I would say, please use, AI in an ethical manner. Now, that's a conversation for another day. But whenever you're doing it, please use it like an assistant for sure. But definitely not use, it to write your paper. Internal peer review support. Ensure that you have a team of people who can read your paper and tell you, how to improve it. Once you've identified your journal, and that was your first step, try to write in the style of the journal. Ensure your results are very clearly written, because most people would love to read your paper once you've caught like a hook, keten. The hook was your name of your paper, but the results is the crux of the paper. If your results are boring, people are not going to read your paper. So please ensure your results are very nicely written. Tables are the life of the story. Make your tables relevant, succinct, and useful. Very important to draw dummy tables. Now, sometimes I think the art of dummy tables is lost, but I'm old world and I still like the idea of having a dummy table before I proceed. Now, whenever we do a detailed conversation on data, we will talk about dummy tables. But for you today, maybe if it's a new word, please note it and discuss it with your mentors and your peers, or even with ChatGPT, as to what dummy tables are. First table establishes the context. That means it establishes the environment in which you have done your research. Second table lays out your story. It talks about your primary indicators. The third table explores further your story, that is looking at your secondary indicators. Any tables beyond these, please take them to additional tables. Critical tables are 1, 2, and 3. Do not go beyond this. If you are forcing yourself to go beyond this, please take that to additional tables. Most people will not read that material. Now, the Equator Network has very good guidelines for reporting, and you should definitely look at them. Now, because we always thought randomized control trials are the sine qua non and the gold standard, we always look at consort guidelines. But now that after I'm hoping today's lecture, many of you will think about writing observational studies and looking at simpler data and information. Please look at the STROBE guidelines for observational studies and the PRISMA guidelines for the systematic reviews. There's also now the trend of, publishing your study protocols. If you think that is of interest to you, if you're doing something really innovative, and which I see many young surgeons are doing nowadays, please write it using the SPIRIT guidelines. So there's a very nice one. Please just go through it and you can have a look as to how to go about writing. Now, last but not the least is, where shall I publish? Should I publish in Nature or should I publish in medRxiv? Now, I'm hoping that people realize that Nature is one of the higher impact factor journals, and medRxiv is not a peer-reviewed publication. medRxiv is what is the word that they call it? I'm losing the word. So medRxiv is not peer reviewed, but it puts your message out in the universe. So in case, you are not able to publish it, but at least medRxiv will put it out there. So here are the 4 parameters to look at where you want to go. And this is where you started with. So I want to look at, is my topic of national or international relevance? Is turnaround time relevant for me? Sometimes there are journals which say 6 months, 8 months turnaround time. By that time, if I was writing in COVID, the topic would become irrelevant. So I have very critical, this parameter is turnaround time. But if I'm writing something in a space which is, a protocol, like I'm writing a protocol on a new technique of pancreatic surgery, maybe I want to go to a high-end journal, even if the BMJ has a turnaround time of 6 months. It's okay. Depends upon what your target is. Now, fees. If they're going to charge us by any name, I want to know if I have the money to cover that cost. Does my institution cover that cost? Do I have that money in my pocket? Or do I want to go for a journal which is not going to charge me any kind of, fees for publication? Then there's the indexation and impact factors. So the quality of the publication is very, very important. And sometimes, it's important that I understand what is my target audience. Sometimes I may go for a journal which is an Indian target audience, young people target audience, which may not have very high impact factor, just be indexed, depends upon what is the impact my publication is going to make. So my take home messages to you are that anybody can do research. It is not brain surgery. You can do it. A lot of it is intuitive and common sense. And it's like cycling. When you start cycling, you will realize it's not so difficult. So take the first step. Defining the research question is the one big thing. So finding the area you want to work in and defining your research question. The rest is not so difficult. Like in all medical matters, make sure that you understand that you cannot do a research paper by yourself. You need a team. Take a mentor, and for mentors, please take some juniors so that you can handhold them through the process. The most important thing in writing well is reading, reading, and reading. Read. You will realize that there is a particular kind of author. It actually makes it very interesting even to go to conferences. Because if you've read that particular author's kind of publications, you are able to connect with his conversation and his presentation much more and much better. And your conversation beyond, the interaction beyond the sessions also is more interesting because the speaker realizes you've read him. So it's very important for you to read, read, and read. Start small. Don't think you want to start everything with a randomized control trial. Start with observational studies on a topic that interests you. Do not listen to topics that may not interest. And please, here, I really require the guides to make sure that they're going to commit today that you're going to let the young researcher and his inquisitiveness fly. It does not matter what that first thesis is going to do. As long as it interests the person, the student, please let him do it. Quality matters. Whether your study is observational or interventional. Data quality and analysis are very, very important. Do not underestimate those. So if you think you can just make up some data, let me tell you, it's not going to happen. People are smarter. No. What's the presentation without something new? Because all of this, I'm sure all of you knew. There's nothing really new in this, except probably for this slide. I like this word, POEM, which is patient-oriented evidence that matters. It totally reverberates with my interest in patient advocacy for research. So it's very important that whatever research you do, ensure that there is a parameter directly impacting your patient. At least one parameter is there in that study that you're doing. CDM, or the common data model, is for standardization of data collection. Now, standardization of data collection is very important because if I call a chair a table and the world calls the chair a chair, we are going to be comparing chairs and tables and it's never going to match, right? So it's very important that our language says the same thing. So the Observational Medical Outcome Partnership, or the OMOP, has a common data model, which is an open community data standard, which you can have a look at and use for making your own when you're making your data collection form. It's a free data standard. The OHDSI, that's OHDSI, is pronounced as Odyssey, is an observational health data sciences and informatics vocabulary, which allow organization and standardization of medical terms across globally to many clinical domains for the common data model. It is something like the International Classification of Diseases, or the ICD. If you're using the ICD, you can continue to use the same. Other than that, these are two interesting terms that you can use. So that's it from my side. Thank you all so much for your patient listening.